watching Mighty in God TV program. Today, I have a special two guests that join me. I'm sure that you guys are going to be excited and also get a lot of knowledge about what we need to know about our current problems, COVID-19 and our heart disease, because these are the problems that really travel to us. A lot of people worry about it. So my guest today is Dr. Douglas Harrington and my best friend, Estrella Harrington. And today they are going to join me to talk about also their relationship. It's called Inseparable Love, how they love each other. So let's start from Dr. Harrington. I would like to introduce Dr. Harrington. He is a cardiologist. He's also a medical innovator. He is a very popular keynote speaker. He's been on TV, Fox TV, ABC, NBC, CBS, and Good America TV show. And also Dr. Harrington has received Lifetime Achievement for Presidential Volunteer Service Award, and also something very special is the ABL Innovation in Healthcare Award for post-test. What is a post-test about? He is going to explain to us later. Okay, so stay with us. First question that I have was Dr. Harrington, because you've been in this business for about more than 25 years, right?
More than 30.
Oh, more than 30 years. Okay, so since COVID-19 is so many people concerned and worry, and some people still don't get answer. They don't think that they get a accurate answer. So I would like to know how accurate are COVID-19 diagnostic and the antibody tests, and what type of the test do you provide?
So there are 4 major ways to detect COVID virus. The one that's most commonly used is a molecular test, which requires a swab of either your nose and throat, your nose, or your mouth. And unfortunately, it requires some skill to collect. It looks at the nucleic acids in the virus, the thing that makes the virus a virus. And it has a false negative rate somewhere between 20 to 40%, depending on the hands that are doing it. It's actually a very sensitive and specific test if the test is collected well. The problem is it can't tell the difference between living virus and dead virus, and that has resulted in a lot of false information that's been distributed to the public. So that's the most commonly used test. Now the second test is for antibodies in your blood, and what that means is that you've been infected and your body has successfully mounted an immune response to it, and you have detectable antibodies. And in that case, it's very important to make sure that the test that's measuring your antibodies is EUA, which is Emergency Use Authorized by the FDA. Now, the particular test that we use for our community outreach through the Garter Heart Foundation is by Abbott Laboratories, and it has 100% sensitivity and almost 100% specificity. And the reason that's important is because you don't have false positives and you don't have false negatives with those numbers. So it's very important that the type of antibody test is very carefully done. The third type is called an antigen test. And what that's doing is actually detecting the virus proteins, the covering of the virus. And it's about 93% sensitive and 100% specific, but a negative result is not very helpful. And it's still a very useful test because it can be done in home or at the doctor's office. The fourth way, the gold standard, which is not used clinically right now, is to culture the virus. And we do culture the virus just to document some of the findings that were erroneously reported initially. But right now, the most common test is the swab test, followed by the antibody test. The swab test is for people who have symptoms and acute diagnosis. The antibody test is for people who may have been exposed, may have had something they think in the past, and it also helps the public health officials determine the actual rate of infection in a population. So I hope that answers your question.
Thank you so much for your information. And as of today, there are so many people that worry about, in America alone, there's 4 million, more than 4 million cases, and 145,000 people died from this COVID-19. And do you think it's a lot to do with the tests we have done? That's why, in the world, we are the number one now. What do you think about it? Is anything to do with race? Like I'm Taiwanese, Chinese. Any race can make the difference? Or any other factor that make America become the highest number? Also, anything that you want our audience to know about this COVID-19 things?
Right. Well, first of all, let's dispel a few myths. Number one, we do not have the highest death rate in the world. Our death rate is currently about 0.01% by data provided by Johns Hopkins. On a death rate basis, we don't even make it into the top 20. However, we are in the top few countries in terms of testing now, and that has been deployed. There's still occasional shortages, but we're doing an extremely good job of testing. And the third part of that question, if I understood it correctly, is worldwide, you said 5 million, I think, somewhere in that ballpark. Well, just as a way of comparison, in 2009, during the H1N1 pandemic, 69 million people were infected. And the death rate from flu is still quite high. The unique thing about this particular virus is that it is particularly harmful to the people who are also at risk from flu. Those are people with diabetes, obesity, cardiovascular disease, cancer, hypertension, immune suppression, and COPD. And the reason for that is their immune system is not really as optimal as it should be. Now, the virus itself is very interesting, and there's a reason why we see some heart attacks and strokes in younger people. The virus binds to a receptor in your body called ACE2. This receptor would be familiar to people who take blood pressure medications because the renin-angiotensin system is one of the targets for blood pressure medication. But the virus loves that receptor. That's how it gets into your cells. And it turns out most of those receptors are on the lining of your arteries. And that's why we see the types of symptoms that we see in people, because the arteries and the endothelium, the lining of your arteries, is the biggest organ in your body. So the virus can affect any organ with a lot of blood vessels. So your brain, your heart, your kidneys, your liver, those sorts of things. And so with that, I would say that because we're doing more testing, we're detecting more people. As we identify more cases, the death rate continues to go down. The interesting thing is that the majority of people who are being tested for antibodies don't remember having symptoms or had very mild symptoms. So for most people, this virus is not a problem. But if you have one of those conditions that makes you extremely susceptible to damage, then you are at risk, and we need to take protection. Now, I've heard a lot of discussion about face masks and hand washing, and that's great. But one of the things there's a reason why people are using sewage to track the pandemic, because they can identify an outbreak in an area because the virus comes out in your urine and in your stool. And because of that, you should be extremely careful around toilets, because what people don't realize is toilets can fling droplets up to 20 feet away, and it's a dangerous source of infection. So in families that have a member infected, if they have more than one bathroom, the affected individual should use that bathroom exclusively. Okay.
Wow. So friends, don't get panicked by the numbers that we saw on the media or news. The ratio is still, the percentage-wise is still very low. And also, Dr. Harrington already told us what we need to pay attention to. So I'm going to buy a new toilet. Just make sure I can carry everywhere I go.
Just step sideways.
No, I think it's just sometimes people don't realize, and that's why you just make sure, especially when you go to the public toilet, you make sure you clean it, and make sure you use protection. And they have protection in there. And if you are within the family member and you have to quarantine somebody within your family, if they're quarantined and they have their own personal bathroom, and we see that study also from Taiwan and from Singapore. Yeah? And then because if you mix the toilet, and then we saw this too because we just recently have a patient that we have to quarantine.
Oh, really?
And then we quarantined that patient in the one bathroom, and her and I think one of her either father or mother was sick, but the two of them shared the bathroom because they're both sick, and the rest of the other family don't.
Oh.
And then to some of our surprise, also we see family that some have it and some don't within the family. And then there's so many different things that we don't know right now. But one thing is we shouldn't be afraid, but we also shouldn't be, we should still be vigilant.
Yeah, you should be cautious.
You should be cautious. Don't put your guard down. And
Okay.
one thing, the most important part is, like he said, if you wear a face mask, it's because, how you say it? You touch your face?
The average human touches their face about 2,000 times a day. And so if you put your hand on a surface and it's contaminated with virus and you pick your nose or scratch your nose, you're inoculating yourself.
Wow.
And, so the mask does more than just protect the people around you. It also protects you from infecting yourself. So it's valuable. And the data supports the use of masks. Even though I know where we are in Orange County, there's some resistance to it. It's a good thing to do.
But even though if some people are resistant to it, I mean, because we have people that get mad at people that don't wear masks.
Yeah.
What we were saying is, I mean, everybody have their own freedom, and we want to respect that.
Right.
And then when we wear masks, is because we also want to care for other people.
Yes.
But some people can't wear masks because there's some underlying condition, and some people don't want to wear it. But you know what God said to us? We don't get mad at them, but we just understand it, And then it doesn't mean that, suddenly we also can't judge them right away. What is their motive behind that, And that's why it makes people become resentful. And God doesn't want that on us either. So whether people wear masks or not, the most important part for us is to be vigilant with our hand.
Yeah.
Like the doctor said, even we wear masks, people say you still can get it because your hand touches many different things.
I know.
So wash your hand, and that will prevent a lot of things.
I see. So make sure that you wash your hands. Make sure that you don't touch your face all the time. So it's not all about the mask or social distancing. Excuse me. So my next question is, what do you think about our medical system and the healthcare service in America right now?
Well, that's a loaded question. I think parts of it are very good, and I think other parts of it are very bad. I think the thing that is, as a physician, is disturbing is that we focus on disease, we don't focus on prevention. And I think that the best healthcare reform we could have would be to shift the focus to prevention so that you don't get... The problem that we have with COVID is we have a lot of people with these things that are called comorbidities, which means diabetes, obesity, heart disease, smokers, COPD. Most of that's due to lifestyle, and so it's all preventable. So I think that if we can shift, that would definitely improve our healthcare system. Okay.
I see. Okay, thank you for that. Prevention is important. And I know every time when I went to your house, I noticed that you have lots of things that, especially in the refrigerator. You are a very health conscious person I ever found my circle of friends, okay? He calculate a lot of things. He pay a lot of detailed things from spice, from the oil we cook. All kind of stuff, right? I learned a lot from you. It's really, really benefit by just watching what you use and what you do. Anyway, my next question is that you have a Guard a Heart Foundation. And I'd like you to tell our audience, our friends, what is Guard a Heart Foundation about? How do you help people and what kind of benefits people get.
Okay,
Yes.
well, I'm sitting next to the founder of Guard Our Heart Foundation, so
Sure.
I shouldn't really be talking about it. She should be talking about it. She's
Yes, the
she
beautiful
and
wife. It's your turn now.
Yeah, along with her friend Vivian and a few other people founded it, right?
Yeah. Me and Vivian, we founded Guard a Heart. We started with Guard a Heart because I have, like you said, he's a food Nazi. I
Yeah.
call him. I mean, I was worried. He always says, Estrella, don't do this, don't do that. I'm like, oh my God. Me and the kids go, why? We're still young. What do we do? And then so we always think that we have time. Remember?
Yeah.
And then I have a wake up call, you know, and because I always think, oh, I'm young and I have to worry about it later on down my path. But then, as you know, I have cancer. So now I learned my lesson. I should have listened to him a long time ago.
I know sometimes you ate food that you say you
it's
should not
like,
take.
no.
I knew that before.
And we're like hiding
I know.
and then eating with ourselves. And then,
No comment.
No comment coming from him. But then I realized too that there's so many information out there in the. I mean, we have wealth of information. You can Google anything, and sometimes even us that is in the medical field, we are confused of all the information. Like we are overwhelmed by the information that we have. But a lot of things also that I understand is when you said people don't really know. They just go straight to prevention. They don't know. So when you ask, what are you preventing? I just want to be healthy. I'm just preventing. I mean, so when we start looking at Guard a Heart, what do we want to do? We want to foster wellness because we want to live. We don't want to live. We want to live long, but not in pain or in cane. We saw somebody said that. We don't want to live in pain, you know.
That's so true.
I mean, you can see some of this, like he just showed yesterday that this 90-year-old husband and wife, they were dancing together, and they were just still very, very strong. And then so we are wondering, and like you want to live long, but you also want to live healthy. So our whole mission is learn, detect, prevent. We need to learn. Learn why we want to do prevention. But in the meantime, before we go to prevention, we need to also detect. We need to know. We need to measure us. What is wrong with us? What it needed to, you know.
What needs a tune-up?
Well, yeah, what is need to tune up? Like, you know, you don't just service your car. You need to make sure you check what is need to be serviced.
Yes.
And yet here we are with our life. We just say, oh, I'm preventing this. I'm drinking juice. I'm drinking this. I'm drinking that. So I'm asking all the people. I say, you're drinking all of this different thing. You're doing all this prevention. What is your goal? Where's your number? They can't answer you. And then so that's why we're doing the education, starting from learning what it is, detecting what it is, and then preventing.
Okay.
What it is.
That's pretty good.
And if I could add to what she's saying, the whole idea, first of all, everybody that's in Guard a Heart is a volunteer. Nobody takes a salary, and 100% of the donations go back to the community. So right now, Guard a Heart is leading the COVID testing in the community in partnership with Coast Hills Church and other organizations. And what that's allowing them to do is to provide their service, which is part of the mission of the company, and to also educate people on the fact that with COVID, we will get through this. This is not the end of the world. We're not at end of times right now. We're just going through what I consider to be a speed bump.
Yeah.
And there is hope, and there are lots of things happening that are very positive. But Guard a Heart really targets the things that have the most impact, like heart disease, pandemics, depression,
stress management,
all of those things, because people don't like to talk about mental illness, but it is a cardiac risk factor, and it's a risk factor for cancer.
We call that mental wellness.
Mental wellness.
Mental wellness, okay.
Right.
Yeah, friends, if you want to know more about Guard a Heart, please go to their website. What's the website address, please?
GuardAHeart.org.
GuardAHeart.org.
It's all one word, GuardAHeart.org.
Yes.
Okay.
You will get a lot of information, and they are there to help you at your request. So just join them if you have any further questions.
You can email us.
You can email them. What's your email address?
You can go to Guard a Heart and say contact us, and then we'll reply.
Okay. Yeah. So that's available to anyone who needs help. Next question is, what are your secrets to wellness? I know that you have been talking about prevention, how to take care of our health, and you have a lot of secrets. I know.
No secrets.
It's back to basic.
Yeah.
Organic food is one of the things that we should eat. Or I know this is we're going to cover a lot of different things, but
Can I take
just yeah, because our time is kind of a little bit
It's getting-
limited.
I trained her, so she can talk about
Okay.
this.
So there's a 5 pillar, and he add one more 6 pillar of
Six
wellness.
pillars.
Yeah. So we're looking at the nutrition. We also have to look at fitness,
Exercise.
So we need to know what we eat. But and then if we go back to basic, real food, not all processed food and everything. That's one. And then fitness. A lot of people think if they just exercise, run, it's okay. But fitness also, you need resistant training. And a lot of people have misunderstanding on that. And then stress management. That's what we call it, mental wellness. There's so many different aspects that people don't realize that it affecting them in stress. And then after that is medical management, which is, if your doctor prescribe you certain medication, what is the statistic, 50-50?
Well, 50% of the people given a prescription for like a statin don't fill it. The 50% that do fill it, only half of them take it. So at the end, you end up with less than 25% of people actually taking medications like they're supposed to, right?
Wow.
So,
And then the other one, yes.
and then the same goes, certain supplements are very helpful, and if you take them, you should take them the way you're supposed to.
But you have to make sure that you're not over supplement, then you
Right.
become toxin.
Yeah.
Oh,
Yeah,
okay.
toxicity. Because people, so many things. I say, I want supplement this, and then they have
Right,
like
they got a whole bunch.
And then
they don't even know what they're taking.
I take 20 supplements a day. Yeah, okay.
And then they have like, and then you
Toxic.
can become toxic because of the supplement. And actually, we see some people get hospitalized because of that.
Wow.
Yeah, and then the other one is
the
substance
right-
abuse. Yeah, so the right medication, follow it, and then the right supplement, follow it. Substance abuse, I mean, people don't talk about it, but yeah, there are abuse on, drugs and some, or even you can even use your own drug and you abuse it, or you drinking and all of the smoking. And then the other one that he add is sleep.
Sleep.
Yeah.
Sleep is a big risk factor for cancer, hypertension, cardiovascular disease. And that's not just something called sleep apnea. That means just abnormal sleep patterns. Like, we have 6 kids, and I would say half of them are vampires. They're up all night, so we're trying to get them to shift their
Yeah.
clock.
Okay, I understand that
They
part.
wake up all night and
Yeah.
then they sleep during the day. But I think that's what also we need to have a consistency with our sleep. We call it the REM sleep.
Right.
We sleep at a certain time, wake up at a certain time. When we keep on changing, our body also does not recover. Get confused.
Oh, okay.
And then when we sleep, our immune system actually works when we actually get to sleep in the REM sleep.
Okay.
So if we're tossing around because we are stressed or we can't, and there's a lot of meditation that can help with that to get you to what they call it, a REM sleep.
I see. So that says in the nighttime you don't get enough sleep. Can we sleep in the daytime to catch up? Because sometimes I do have the problems. I cannot sleep well. And then during the daytime, I must take another couple hours. Is that healthy? Or is that...
Well, yeah, and you're not the only one that does that.
Me too.
It's better than not sleeping enough at all. It is. Having a regular sleep pattern is healthier, but if you're doing it regularly, as long as you're getting sleep, I think you're okay. The people that I worry about are people who can't sleep or who some days sleep well and other days don't, and those are the people, their bodies get confused and they get stressed.
I see. Yeah. Well, I know it's kind of like a physical clock. Sometimes it's just hard, especially you travel a lot. I travel a lot too as well. So it happens. But anyway, thank you for your the knowledge that we need to know. And my next question is that what are the most important things that people need to know about health movement right now? It seems like people are getting more conscious about getting
Healthy.
healthy. I know that emotional health is very important because a lot of things will, because of people that have depression, they were stressed out, just like you said, stress management. That's part of that is really important, and because depression is really, I mean, the number one illness right now after this COVID-19 things, right?
Yeah.
So what the most important things that you would like to tell our audience?
Gratitude.
Well, yeah, the hallmark of people who live a long life and do well are people who are grateful for what they have. If you go to every blue zone, everybody focuses on the food they eat, how they walk or exercise. But the one thing that's common to all of them is gratitude. And that starts with your soul, being grateful for what you have, not being envious. And it's actually, you are able to teach people to be grateful, and you are also able to develop it yourself. And it has a huge impact on depression and stress, because if you suddenly find yourself saying, look, I'm here, I may not have everything I want, but I'm alive, I woke up this morning, and I can afford to put food on the table, or I have some opportunity that I'm facing, and just be grateful for it. It will reset your internal stress clock, and you will probably find ease in that.
You have a study on that, isn't it?
There is a study on that. There are actually more than one study showing that the development of gratitude in your patients is actually very beneficial on all fronts. And so we focus on really trying to foster that. People that have a belief system in God tend to find it easier to develop gratitude than people who don't believe in God, don't believe in Jesus Christ, that sort of thing. And there's a reason for that, because you have some relief that there is a higher authority watching over you, and you can be grateful for the things that you have, right?
Yes.
So
Yes, that's very important, that to have gratitude, appreciate what God has given to us. That is very simple things to do. And I thank you so much for what you just sharing. So our first section is going to end very soon. And I ask you guys to go stay in tune, because we're going to go to the next section, which is about their relationship. I'm sure a lot of people that, that they need to know how to have intimacy relationship. So this is the timing we are going to continue. So stay with us.
The preceding program was brought to you by the Holy Spirit Broadcasting Network, HSBN Television.